childhood obesity is something that you spent a lot of time thinking about. These public-private partnerships have become very well known. Your ability to target these at-risk youth of obesity-related diseases, over 1 million this year is the goal. It's amazing stuff. You talk a lot about prevention. And one thing that sort of comes up, and I find interesting as a doctor, it makes perfect sense to keep people from getting sick in the first place. But the other side of prevention, this idea of, should we be doing more screenings? Might that find abnormalities that lead to biopsies, worry, concern, and cost? Can you take prevention too far? Can it be a detriment as far as costs go?
Well, I think you have to look at it in the aggregate. And if you look at it in the aggregate, the answer is no. That is, if you do more screening and you find cancers earlier, you'll spend more money on treatment. But if you add 10 or 20 or 30 years to someone's life and they're a productive employee over that lifetime, and they contribute to the rest of our welfare, you've not only had an economic victory, but you've also fulfilled the moral imperative that we should all live as long and as well as we can. Will that individual person cost more? Yes. Will society pay more? I don't think so. And if you look at, for example, what we've done is to try to first reduce the calories in school. Yeah. Through better lunches and reducing the vending machine calorie content of of drinks and snack food. And we've had a lot of help from industry in doing that. That's good. We try to increase the exercise programs in schools and communities. But we recently announced a really interesting thing with Aetna Life Insurance Company and Blue Cross of North Carolina and Massachusetts, and PepsiCo as our anchor employer, to offer health insurance policies to the children of employees 3 through 18. Either all of them are kids whose body mass index is 85% or more above the average. And they get 4 trips a year to a physician and 4 trips to a dietitian. That's great. To try to do this preventive work. Now, there's no question that if you look over the lifetime of these children, we've got kids coming up with type 2 diabetes. Your profession told us 2 years ago that we could no longer refer to type 2 diabetes as adult onset diabetes. Here in Harlem, where we are, we had a 9-year-old child 3 years ago diagnosed with type 2 diabetes. So if you can just turn the tide on that, diabetes and its related conditions account for approximately 25% of all the Medicaid expenses. The savings to society will be enormous. So will some individuals cost more because we find their cancer and we have to treat it? You bet. They'll live longer and it's good for them. But the overall cost of the system will be much lower if we do this.
Let's talk about staying on health internationally. AIDS, another area which you've had a lot of focus. You focused on this very carefully since being president. Drug costs are something that come up all the time when it comes to overall health care costs. You've been able to lower these costs in so many countries down to less than $1 a day in some places. How do we do some of that same good stuff here domestically in terms of bringing down some of these pharmaceutical costs? They're so high. They're really hurting us.
Well, yes, the McKinsey study done a couple of years ago says that we pay $66 billion a year more for medicine, and that at least our older populations consume relatively less per capita than other wealthy countries. There is a very simple answer to this, which is that we have made a bargain with our pharmaceutical companies. We've said to them for decades now, we love having you in America. We're proud of you. We know you have to spend a lot of money on research, and then you market the drugs and all. So we will eat your research and development costs in American prices so that you can sell exactly the same drugs you sell to us for less money in Canada and Europe. Even for example, our AIDS clinic down the street here in Harlem, the taxpayers pay $10,000 a year to treat people with the big pharmaceutical company's AIDS medicine. That medicine costs about $3,500 a year in Canada and Europe, countries with per capita incomes as high as America. Right. Now, if we're going to get out of that or move away from that to close some of that $66 billion window, keep in mind Europe has a lot of very successful drug companies and they don't do this. We need an honest, open, clear dialogue admitting that we're proud of these companies. They've got thousands of employees, tens of thousands of employees. They've done a good job for America. They've saved countless lives. But we just can't go on subsidizing it as much as our other competitors can. So how can we reach a different arrangement so that we keep the drug companies healthy enough and we keep them developing new medicine? The system we got is not working very well. They don't have a lot of new medicines in the pipeline, partly because we've lost the influence of the emphasis on research and development. So many new advances, particularly with the sequencing of the human genome, have led to patents on smaller and smaller and smaller components of what ultimately becomes a blockbuster drug. So a lot of new drugs are not coming because we haven't re-examined how the patent process and the research process are working together or not working. Meanwhile, we keep eating all these costs, and countries just as wealthy as we are getting the same drugs made by the same people for less money, which is why there was so much opposition to allowing re-importation from Canada. What I recommend is, let's don't pretend these drug companies are bad people. They've done a lot of good for us. But let's be honest that America is no longer so dominant over Canada and Europe and Japan that we can afford the whole subsidy. And the one good place to start is what President Obama has proposed, letting the federal government do what I do for AIDS drugs, letting them bargain for lower prices for well-established medicines bought in bulk for the benefit of our seniors. That's a good place to start. And we just need to work out a new deal with them so they can do well. But, you know, for most of the 1990s and the early part of this decade, they earned 18%, which is a huge return. You know, Walmart is what, 5 or 6%. And it is fascinating to see that at the same time, because of a lot of these factors relating to patenting and scientific advances, the number of new drugs in the pipeline seems to be slowing down. So we need to examine both how we can get the benefits of the genomic advances and how we can lower the cost to the consumers.
We're having a health summit of our own right now on Larry King Live, talking to former President Clinton. There is an issue that came up this week that is one of the most controversial in medicine. It has to do with stem cells. Former President Clinton has been down this road. We'll ask him about it after the break.
We have a common task and a common challenge.
Why can't we see that we are all in this together?